What if I told you that your healthcare system isn't designed to heal you, but rather just to make you dependent upon medications, procedures, or surgical interventions? Hi, my name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. So, welcome to my channel, All Things Holistic Health. If you want to learn more, we do have various different communities, whether you're interested in training under me for holistic health coaching, you just want to learn how to treat yourself and your family, or you are Black or Afro-Indigenous and you'd like to connect more with your roots and your ancestry of healing. I have 3 different communities that are designed to really help you to connect with holistic medicine. Remember, this is a journey and not a destination, and it does take time. So, with that being said, let's jump right in. So, let's talk about symptom-based care, because that's what the conventional medical model has you in. It's highly reactive. You're constantly waiting for the next thing, and every symptom is naturally some flaw in the body that needs to be fixed and corrected, rather than more of a healing mindset or a healing and a holistic lifestyle where when your body expresses symptoms, you're aware of them, you educate yourself on what they may mean, and then you give yourself the nutrition that it absolutely needs. Because let's face it, your body isn't deficient in pharmaceuticals. In fact, it's deficient in key nutrients that allow your body to actually work and function as well as prevent disease. Now, pharma benefits from you being undereducated about how your body works, about nutrition, etc., because oftentimes what'll happen is people will go nutrient depleted over a period of time. That nutrient depletion then leads to accumulated toxins, organ function begins to go down, and then eventually they create disease. And so the pharmaceutical industry and the healthcare system as a whole benefits off of your ignorance and your lack of education. And so what happens? You're constantly going in to get less and less answer, less and less clues, and you're being thrown around from provider to provider. So a lot of practitioners, or excuse me, a lot of patients, what they will do is they will go into Facebook groups or they will post things really looking in desperation for answers. And so the challenge with that is, again, you're getting generalized information. You're not getting personalized information. And so generalized information can be helpful and point you in the right track. It doesn't replace you really understanding personally how your body is functioning. And you do that by in-office lab testing, or excuse me, in-home lab testing, remote patient monitoring, genetic panels, biochemical panels, really understanding the depth of it. I do have a webinar, which is in one of our wellness collectives for the beginning of the year, talking about health tracking. It's also in the Heart Health Collective if you want to invest in that. There is a link below. And so the collectives just have lots of education webinars and things like that. And there's single watch webinars too. So I also recorded a webinar about the hidden truths about conventional healthcare. So I just touched on a few of them. We know that chronic disease is driving our healthcare costs, and we know that our chronic illness and our chronic disease is largely preventable as well as based off of lifestyle modifiable factors, meaning things that we can do proactively. So join me as I educate you on how you can live life more holistically and more naturally for many, many years to come. I teach a lot of webinars and educational information really to help you, educate you, motivate you, and inspire you to live a healthy life.